So if a patient comes in and they're having issues with their eyes, whether there is pain or lack of vision, we are going to examine this area over here because if there is a break, there's going to be an impingement on that nerve. That bone is going to compress on that optic nerve. So we're not only looking at the foramen, but we're also looking to see if there's anything going on here with the strut. All right, so we have these different types of orbital fractures. The first one here is a blowout fracture. A blowout fracture occurs when the floor of the orbit breaks, and then you have the inferior rectus muscle being forced down into the maxillary sinus. And this is it causes diplopia, double vision. It causes double vision. Okay, and so here's an example with a baseball hitting somebody's eye. Did you guys look closely at this baseball?
Yes.
Did you notice that?
Is it Cypress College?
It's like your logo. Your logo. It's your patch. Yeah, I got a lot of time on my hands, guys. Tripod fracture. Tripod fracture. It affects your zygomatic bone, and so it is a break or a separation on the three processes. Remember the frontal process, zygomatic process, and then the maxillary process. Okay, so that's a tripod fracture. Okay, but it's your cheekbone, but it involves your orbit. All right. So here again, look how thin that bone is. This is the strut. There's your optic foramen. So if they're having some problems with their vision, eye pain, anything like that, then we're looking at the foramen, but we're also looking to see if there is a compromise of that strut, if there's a break on that strut. And then you have your superior fissure, you have your inferior fissure right here. Sphenoid bone. Okay. Palatine bone, very, very hard to see. It's a very thin bone right there. And then you have your ethmoid and then your lacrimal. Oh, same one? What's going on here? Oh, okay. So it's just, again, it's just pointing to the different parts, and it tells you the nerves or the types of arteries that you will see. That you will find in those different foramens and also fissures. Okay. This is why I put it here, because this is a little bit appropriate. Because when we're trying to visualize this, we have to understand the orientation of that optic foramen. So here's the orbital orientation. So if you guys want to go back now a few pages, a few slides. The optic foramen is part of the sphenoid bone, and again, it gives way for the optic nerve and extension. It is an extension of the retina, and it is located right here. The optic foramen is right over here. So for us to be able to look at that optic foramen, a small little hole through the orbits, we're going to put our patient in. First of all, we get him a true lateral. Then we use this acanthomeatal line, which is the line where your nose attaches to your EAM. That has to be perpendicular to the image receptor. Okay? Because now we're trying to bring this down. So when we line this AML, it will now come in this angle. Okay, by tilting your head up. Okay? Now what we want to do is the foramen is also going to be medial. So now we have a second rotation of the head. First we have a tilt, now we're going to do a rotation. And to get into that area, we're going to rotate the head 37 degrees. So now it's this and like this. Okay? It's acanthomeatal line perpendicular, where we're going to rotate 37 degrees. Okay, here's your image receptor. Okay, so 37 degrees. And then we do our central ray exiting out of the orbits. Okay. Remember I told you when we're doing facial bones and skulls, it may require more than one angle. So thank goodness it's just angles, tilt, and rotation of the head. The central ray is going to be perpendicular. Okay, so we're good. This is also known as, we call it 3-point landing, because if you do this and this, here's your image receptor. It is going to be my nose, my cheek, and my chin touching the image receptor. It's called the 3-point landing. Okay? 3-point landing, your nose. Okay, because here's your image receptor. You're going to be like this and like this. So those three areas of your face is going to be on the image receptor, or on the table, or on the wall bucky, and it's going to be your nose, your cheek, and your chin. This actually has a name. It's called the Reese method. So AML perpendicular with a 37 degrees rotation is called the Reese method to visualize the optic foramen. We're going to be doing this in lab. Okay, so we're going to be practicing the Reese position in lab. So if you get a properly positioned Reese, there's the optic foramen right there. There it is. And what's that little bone right there? Okay. Yeah, so we are looking at the optic foramen, and then we're also looking at this, which is the strut. This is the strut, the sphenoid strut. Okay. We generally do orbits bilaterally, so we do one and then we do the other for comparison. Okay. But in a properly positioned optic foramen, this is going to be found in the lower outer quadrant. In other words, if we were to separate the orbit into four separate quadrants, so here's the orbit. If we divided it into four, it's going to be found in the lower outer quadrant. If we look over here, it's going to be found in the lower outer quadrant. Okay, that is a properly positioned Reese. Okay. Now we generally do this in a PA projection because, why do we do a PA projection?
Closer to IR.
Again, closer to the image receptor, right? It's a thin bone, so we want very good detail. Can it be done AP though? Yes, we do it. Yes, we can. Answer is yes. So if you can't do one way, we can do the opposite way. So now we would do this, okay? Here, it's the side down that we're interested in, okay? It's the side closest. Over here, if we are doing this and this, now it's the side that's furthest away from the image receptor, right? We're just doing the opposite. So we're not looking at this one, we're looking at the furthest one away now in an AP.
It's 53 degrees.
It's approximately 37 degrees rotation from the mid-sagittal plane, or 53 degrees from the image receptor. You guys get that? Dan said 53 degrees. He's correct. Because this is 37 degrees from your mid-sagittal plane, but when you measure it from here to here, this is 53 degrees. But 37 from here. Is that on the slides? Okay. I think it's the one on the slides. I'm glad you brought that up. Okay. questions on this one? I mean, I could read it to you guys. Okay, A is dichromatic prominence. B is maxilla.
Keep going.
That's one of my biggest pet peeves is when I see instructors reading directly from their slides. I can do that, and I can do it very well. H is master process. I is angle. It's already self-explanatory. I don't need to tell you guys. Okay, you guys have the slides. Okay, so here is the roof of the mouth. You can see that there's two divisions. So this is the roof, the maxilla, and we have the hard palate. So this is the palatine process, and then back here is going to be the palatine bone. Okay, what is this? Without looking up there, what is this?
Arch.
It's the arch, the zygomatic arch. You know what we call these? We call them the jugs, because they look like jug handles. Not those jugs. Jug handles, okay? They're jug handles. But you can see why we call it jug handles, okay? And then you have the different foramens, spinosums, the rotundums. You guys remember that? Your ovales. And then you have your your foramen magnum down here, okay? So this would be, if this was an X-ray projection, what would this X-ray projection be called?
Waters.
SMV, submental vertex, okay. All right. Okay. So here is your submental vertex. Without looking up here, can we see where the ethmoid sinus is? Without looking up there, which letter is the ethmoid sinus? I think, okay, it could be L, it could be O. I think L is pointing to this bone right here. I think this is thin bone, palatine bone. I think it's a palatine bone. What's L?
It is.
It is palatine bone, okay. So then, yeah, so either one would have been correct because it's pointing to this general area, so this is the ethmoid. So then if that's the ethmoid, then what would this be? The sphenoid, okay. All right. Yes? Now we're going to cover some more of this in the next few slides. Yeah. All right. Let's begin the next set of slides on positioning. Does anybody need to take a break? Yes? Okay. 5 minutes? 5 minutes? Okay. 5 minutes and then we'll get started on the next set of slides. Hey, Kat, did you get the quiz?